Jaide is an interesting company. I would love to hear an overview of Jaide Health and what you're trying to solve for and how you're solving it.
Jaide Health, we're building Google Translate for healthcare, an AI-driven platform to provide real-time medical interpretation and translation to facilitate in-person conversations between a healthcare provider and a patient, as well as to facilitate translations of text documents like patient instructions, discharge summaries, patient messaging through the patient portal. All of those provide this sort of a comprehensive language solution to facilitate the limited English proficiency population from being able to enable them to engage with the healthcare community in the same way that everybody else does. So we're really excited about the opportunity to break down these language barriers and facilitate interaction between the patient population and their providers.
Welcome to the next Scale Community Technology and Innovation podcast, where I'm joined by CEO of Jaide Health, Joe Corkery. Joe, welcome to the podcast.
Hi, thanks so much for having me here.
Thank you for being here. So Jaide is an interesting company that's looking to break down barriers in patient access due to language communication gaps, patients that English is not their first language. So Joe, would love to hear a little bit overview of Jaide Health and what you're trying to solve for and how you're solving it.
Sure. At Jaide Health, what we're doing here really is building Google Translate for healthcare. We have an AI-driven platform to provide real-time medical interpretation and translation to facilitate in-person conversations between a healthcare provider and a patient, as well as to facilitate translations of text, documents like patient instructions, discharge summaries, patient messaging through the patient portal. All of those are trying to really provide this sort of a comprehensive language solution to facilitate the limited English proficiency population from being able to enable them to engage with the healthcare community in the same way that everybody else does, because they sort of objectively have a worse experience with the healthcare industry, whether it's greater readmission rates, longer length of stay, poorer adherence to instructions because of that. So we're really excited about the opportunity to break down some of these language barriers and facilitate a lot more interaction between this patient population and their providers.
So before we get into Jaide and what you built, and I think we're going to try to do a demo here, which will be one of our first live demos on the podcast. Let's talk about this patient population. So we know a lot about disparities in health by geography, by economic class across the country. How much is language the driver of that gap in care delivery?
So there's so this population, it's about 8% of the total U.S. population. So 26 million people living in the United States today have limited English proficiency, which is substantial. And, as you're saying, they really have a much worse experience from this. And it really does appear to be attributable to this lack of communication. There have been a couple studies, I think earlier in the 2000s, where they looked at outcomes for this population when they were able to really provide them with comprehensive language services and were able to really move a lot of sort of those health equity metrics in line with the rest of the population when that patient population was provided really with comprehensive language services. The reality is, most don't get that. And there are a lot of reasons why.
Is the gap that patients that don't speak English fluently are not coming in for care, or is the gap once they've arrived for care that their care experience is just suboptimal, so they're not following up on the care plans and things of that nature?
Yeah, I think it's both. I think part of it is that when you have those language barriers, you're less likely to seek out care, especially preventative care, because it's a higher threshold. And as a result, you see, a greater utilization of emergency departments in that population, and actually greater admission rates of that population in the ED through into the hospital. But similarly, once you're in the hospital, the length of stay tends to be longer. I think it's about like a day longer per person, which is significant over time. And certainly the readmission rates are higher too.
So let's talk about how providers are solving for this today, pre-Jaide. So, things that I'm familiar with, obviously you could hire a staff that is diverse in its language, which is not always feasible. But I'm also familiar with Language Line, where you can call into a phone service and they have a staff on hand that has fluency in, maybe 30 different languages. What does that solve for versus not solve for relative to what Jade offers?
Yeah, so I would say there are really like four different ways an organization solves for it right now. There's one is you touched on having like a bilingual staff. Then you rely on I guess maybe you rely on them to facilitate these conversations, but you're limited by, their availability,
Mm-hmm.
um, them doing their other jobs. But you certainly hear about people. It's like actually I see this a lot in like dental practices where they have like like Russian speakers, and like so the Russians all come in on the day when that person is definitely going to be there. And so it guides a little bit of utilization. Then there's, the ability to have in-person staffed interpreters. And this is something that you see at a lot of large hospitals that have a large LEP population, where they'll have large teams who will speak the most common languages and can see patients in person in the hospital. And then, but that many hospitals can't, don't staff that. And also sometimes they're, those people aren't available, especially overnight or on the weekends. And that gap is filled through, as you were saying, like telephonic interpretation through a service like Language Line, or video remote interpretation, which Language Line also does. But there are a number of vendors in that space, and really providing different ways to bring in another human into the conversation. And I think the reality is right now is like, the way this is done is you have to bring in another human into the
Mm-hmm.
conversation. And people with these language skills are a limited resource. And that becomes, really a source of friction in making these conversations happen. One of the interesting things that you see is that, as patient, like if these aren't available to you, people often rely on family members, which is really a suboptimal experience, because oftentimes patients don't really want to share exactly what's going on with them in front of a family member or somebody that they know. It's especially bad when children are having to interpret for parents. That definitely happens pretty frequently. So we're really excited to be able to provide another tool that people can use in terms of accessing language. There are many situations where AI is a great option for you, and there are many situations where you're probably still going to want a human, whether involved as well. One of the things that I'm excited about bringing AI into the equation is that because of this big friction of getting a person either in the room, on the phone, or on the remote, that you have to do a lot of scheduling, or you have to do a lot of waiting. And this is a big complaint we hear from healthcare providers, is that there's a large amount of waiting that has to happen. And healthcare providers operate on, or want to operate, or do operate on, very tight schedules. And so an area where you see this having a real impact is, especially with inpatients, they're not getting seen as often by their healthcare providers, because the ability to actually have that person there to facilitate that conversation is a friction point. And
Right.
this is we actually one of the things that we're actually seeing a lot of engagement from nursing, because nursing, they have so many touch points with the patient. Probably 10 times a nurse probably will see patient 10 times more often during a stay than a physician will. And frankly, if they're not able to communicate with the patient, they are not going to see them as often. And so these patients are getting seen less by nursing. So one of the things that we've really been excited about and hard to see is that actually a lot of nursing is driving a lot of this innovation here, because they want to be able to go in and check in on the patients. We really see this as facilitating a lot of short conversations, because to really bring in a human, there are, that person's time is expensive, and they're often minimums for how long you're going to spend. So you're not going to call in a person to ask, a minute or two of questions. And that's where AI is really going to shine early, I think, is really being able to facilitate those fast, unscheduled, impromptu interactions that you see there. But similarly, I think for like administrative interactions, you often see, like the front desk or check-in, it becomes more, we definitely haven't heard that people are really pulling in interpreters to facilitate a lot of those. There's a lot of, trying to make it happen, but that's another area where we think there's a great opportunity.
So today, I mean, you've alluded to it, but language can be a barrier to access, and an impediment to outcomes at the beginning, sort of before an appointment, during an appointment, and after an appointment. When you think about the care life cycle, and it can occur in so many different places: scheduling, front office interaction, scheduling because you need your family member who does speak English fluently to come with you, treatment plans on the back end, and then obviously the intra-office experience. Is Jade solution today contained to activity in the four walls of the office, the clinic, or is the Jade solution also relevant to the before visit and the after visit part of the interaction with the patient?
That's a great question. There are a number of ways. So right now, the Jade solution works really well for that sort of that inpatient setting, or in clinic setting where within those four walls where you're both present. But as you said, there's this opportunity to engage with patients both before and after the visit. And the way that really operates right now is basically giving the provider the ability to generate those translations for those interactions. And so, for instance, like most healthcare, I would say most LEP patients are not encouraged to use the patient portal in the hospital because there's nobody there to translate the messages that they receive or send in. And Jade gives a healthcare organization the ability to say, okay, well, actually do send us your questions through the patient portal and we can interact with you through that using Jade for that as well. Same thing, with follow-up. We give them the ability to translate, the after visit summary, patient instructions, take that home with them. But then again, they're able to follow up via the patient portal as well, getting both sides of that. You can, with the Jade right now, you could actually also support a phone conversation with them. You put it on speakerphone and have that as there as well. We'll definitely do more to optimize that experience in the future, though.
So let's give this a shot. Let's see if we can
All right.
give a demo.
So let me share my screen. Go.
All right, the first ever live demo begins.
Fantastic. Yeah. And so so I'm just going to hit play in a second, and it's just going to walk through starting the interaction and then having that conversation. So here we go. Hello, I'm Dr. Corkery. What brings you into my office today?
Hola, soy el Dr. Corkery. ¿Qué le trae a mi consulta hoy?
He estado teniendo terribles dolores de cabeza.
I've been having terrible headaches.
I'm sorry to hear that. When did they start?
Lo siento mucho. ¿Cuándo empezaron?
Probablemente hace 2 días.
Probably 2 days ago.
Have you tried anything for the pain?
¿Has probado algo para el dolor?
Sí, he estado tomando aspirina que ayuda un poco, pero esperaba que pudieras recetarme algo más fuerte.
Yes, I've been taking aspirin, which helps a little, but I was hoping you could prescribe something stronger.
Have you had any injuries to your head?
¿Has sufrido alguna lesión en la cabeza?
El fin de semana pasado, mientras jugaba al fútbol, una pelota me golpeó la cabeza. Tuve que sentarme porque estaba mareado y vomité en casa, pero luego estuve bien.
Last weekend while playing soccer, a ball hit me in the head. I had to sit down because I was dizzy and I vomited at home, but then I was fine.
Okay, I'd like to do an exam now, and we should probably get a CT scan of your head to be on the safe side.
De acuerdo, me gustaría hacerle un examen ahora y probablemente deberíamos hacerle una tomografía computarizada de la cabeza por precaución.
Okay, there we go.
Amazing.
Thanks.
I love it. So many questions that come from that in terms of, where you are today and how you got to where you are today. So first question, this was English to Spanish, Spanish to English. How many languages are you working with today?
We can do about 35 languages for spoken conversation, and probably it's closer to 80 to 90 for written translation as well. There's not as have to solve for both the speech and the translation problem, and there's a lot more on the pure translation side to start.
And in terms of the experience, so is this on a tablet? Is it sitting on top of the laptop? Is it tied into the EMR? What does the experience feel like in the room for the patient and the provider? Yeah,
so we provide this as a web-based application, and you can use it on your phone, on a tablet, on a desktop. Where we're seeing, I would say, the most use right now is on iPads. We're working with one emergency department where they have iPads available with this kind of queued up on it with a little shortcut. You click on it and it just opens up, and they have probably 10 iPads that they allow the nursing staff to use and go around with for that. But there's also a lot of discussion around enabling this on their workstation on wheels, as well as the phones that are provided to the staff in the hospital as well. So there are many different ways in which it can be surfaced to that patient. But the real experience, in many ways is you have this device, you kind of, if it's an iPad, you just put it down or hold it between the two of you and have that conversation. Or if you have a phone, you can just hold it up or put it down in front of you. Or if you're doing it on the workstation on wheels, it's available there as well.
So let's talk about quality and security. Maybe we'll start
Yep.
with security because I suspect that'll even be the easier topic. So this is obviously PHI.
Yep.
How do you ensure security with this product, given that it's all sensitive information?
Yeah, so I mean, this is something that we've really been designing from the beginning. Didn't really touch on my background. I'm an engineer, physician, and worked at Google for 8 years prior to starting this company. And during my time at Google, I actually worked on the security team there and then on the healthcare team in Google Cloud as well. So I have a lot of experience and understanding of how you need to build an infrastructure to support HIPAA compliance and security as well. Our CTO also has a ton of background in the security space as well. And so what we really need to do is, we spend a lot of time building the infrastructure from the ground up with the expectation that we're going to be handling PHI and understanding that we need to do everything, to meet those needs. But similarly, looking at, well, how do we also ensure that we're holding ourselves to a higher standard than just HIPAA too? So, going through the third-party audit process. So we actually went through and did SOC 2 certification, which has a third-party audit. And when we were doing that, we also had them do a third-party HIPAA audit as well to give us and our customers the confidence that we have built and architected this in the way that they need to do. There are many processes that we have to go through over the year to ensure that we are continuing to meet those guidelines. But it's been a real, I would say, central area of focus for us, really from the beginning.
So now quality, which I think is a more nuanced conversation, just given that you're dealing with live interactions that can go in an infinite number of directions. So in theory, we'd all like to strive for 100% accuracy on 100% of topics in all scenarios, all languages. Granted, that's not feasible in a human interaction, so the starting point is not that. But how do you think about quality? What percentage of use cases is this information, this translation reliable, where slight difference in words can make a big difference in terms of next steps from a provider perspective?
Yeah, I think that's a great question. Thinking about quality is really important, and particularly because it's going to be different per language. When you think about it, like our experience so far has been that the quality with Spanish is incredibly high. And that has been certainly the feedback we've had from all of the users as well, that, they feel really confident in that. And then, the quality will begin to taper off for languages that don't have as big of a digital footprint, for which both the speech to text and the translation functionality just hasn't had as much to train on. But I expect we're going to see a lot of that growing rapidly over time. And so one of the areas of focus that we've had with our early customers is they've really asked us to focus specifically on Spanish, because that is the bulk of all of their need. So, and they have so many of those interactions that we're able to really focus on that. We can do other interactions as well. We can do other languages as well. But those are areas where, if there's a real question about sensitivity, they might pull in a human. But, for the, those interactions like front desk where, there's a lot more, it's a lot lower risk. And so you really kind of think about it, it's like on a spectrum of where you want to use it. And there are some languages where, you kind of want to be on the left for the really low risk ones. And then as confidence grows, you can continue to expand and grow over time.
So let's talk about Spanish, because it sounds like that's one where the model is pretty advanced. When I think about call center solutions, I hear a lot of times, call center automation can handle 25 to 33%, a third of the calls. So somewhere between a quarter and a third of the calls can be automated. And then the other 75%, 2/3 is left to human interaction. When we talk about Spanish, in this case, in a clinical setting, is it similar to that ratio, or is it something much different, much higher? 99% of the translations can be handled through the tool today?
Yeah, I think where we are today is probably closer to like 25%. I think it's a similar ratio where you could use AI to facilitate that. I think it'll grow over time. But the other thing I think that's going to happen is right now there are fewer conversations happening because of the friction with getting another human in. So I actually think what we're going to see is when we bring AI into the equation, yes, we might be able to tackle 25% of the existing conversations, but I think we might double or triple the total number of conversations that are actually happening.
Hmm.
We're going to get all of those different touch points that just really, either the conversations weren't happening or they were going to try to squeak through without, language support services for that as well.
Where are you in the phase of development? Maybe a good way to phrase that is, what is the footprint today? Are you in pilot testing? Is this something that requires FDA clearance? How many customers are you working with?
Yeah. So right now, we are. So we've built our product, and it's available for customers to use. It can be deployed quickly. We have 3 pilot customers that we've been working with very closely right now. Actually, you mentioned it. We actually did an announcement around Cambridge Health Alliance earlier today. We working with Children's Hospital of Los Angeles, and then there's one other that I can't talk about. Although actually, the both Children's Hospital of Los Angeles and Cambridge Health Alliance, they're really focused on the translation use case because they have a pretty robust interpreter team, and so
Mhm.
they're really looking at this as how can they make their interpreters operate at the top of their license by allowing them to do translation very quickly, because that facilitates after visit summaries and patient messaging and
What
other.
was the driver for these early adopters? Was it cost? They have such large teams and it's becoming cost prohibitive to maintain those teams. Was it desperation? They have so many patients that require this tool and they simply can't find people to accommodate the patient population.
So I think a lot of the big drivers here is really looking at the rate of growth of need for these services and
Mm.
realizing that they're not going to be able to scale up their human services to meet the need that they have. And similarly, they're also really not serving, patients aren't getting personalized instructions. When you look at like a lot of hospitals now, they'll say, well, we have discharge instructions in Spanish, but those are templates that have been pre-translated. And so everybody gets the same one. And so patients aren't getting that level of personalization that someone who speaks English would get. And so that was a big driver we've heard from a lot of these organizations was, okay, let's actually make it easier to translate, the after visit summary, the departure summary,
Mm.
discharge. Let's facilitate patient messaging through the portal in the future as well. So those, I think, were big things that they were looking at of like, we're going to have this huge explosion of growth in interpreter need, but at the same time, we're not really doing as much on the written side either. And so that was a big motivator for them to say, well, we think AI is going to make a big difference here.
Mm.
So they've been very motivated to get engaged and work early with us.
And when was Jade founded?
We were founded about, we were founded about 2 years ago and kind of really started working on this particular product in earnest, 18 months ago.
So maybe let's take a step back and go into a slightly different, sort of more macro conversation. So, when I'm looking at this and I'm seeing this for the first time, but the technology and the capability, the function seems to be transformative in terms of its ability. If you take it to its full manifestation of 30 languages and 99% of use cases, you can apply it to the front end, you can apply it to in the clinic, you can apply it to, different types of remote solutions pre and post visit. And so the ability to break down the language barrier seems to have tremendous potential. And when you think about our country and improving health outcomes and which markets and demographics are oftentimes underserved, this seems to be very relevant to that equation as well. And so on the positive side, you have this incredible opportunity, and this is very relevant to advancing care in that market. And then that's balanced with the reality. 2 years in, we are able to handle 25% of use cases, which is incredible, but it's different than 99% of use cases. And other languages outside of Spanish that maybe are less frequently encountered, probably a little bit further behind. So how long before you're at a place where these types of sort of game-changing technologies can be broadly used without question about, what do I do with the other 75% of use cases? Is that even the right goal, or should we be thinking about things in a different light?
Yeah, I know. I think the reality is as we look at the pace at which AI is improving and innovating, I think AI is going to get to a place where it's going to leapfrog the use of humans for this broadly. And one of the things that is really great about using AI in this scenario is that, especially in healthcare, there's a lot of domain specialization that has to happen. And so you'll see, like, it's like, okay, well, sometimes interpreters are really deep in cardiology, or the people that practice will actually seek out the people who have that experience because they don't want to have to teach them or educate them. Because, oftentimes what will happen is you'll see someone that's like pull out a book and be like, okay, I don't know that word, I'm going to translate. And so there's a lot of domain specialization that has to happen, and these people become experts, and they're incredible at it. But you can't replicate that expertise in humans.
Mm-hmm.
You can replicate that expertise with AI. You can provide a very consistent experience across all of the interactions that you're having, because it's all you're getting the exact same type of quality for every interaction, and quality can be very variable when you're
Mm-hmm.
dealing with humans. There are lots of amazing individuals out there, and I think they will continue to be, but there are also a lot of folks who are not. And so I think that's one way where AI is really going to provide a big difference, is like, it can be able to look at across all domains and be able to, give you that consistent experience over time.
It sounds like the tool improves with use. And so there's a circular component to this. So given how important this tool is to get to its full manifestation on behalf of patients, on behalf of US healthcare, on behalf of the provider organizations, everybody has a vested interest in trying to get there, given some of the benefits that you're speaking of this AI driven tool over a people driven solution, which is cost prohibitive and has challenges in terms of scalability. What would you recommend to provider organizations to help accelerate that process? Would you say that they should be more open to pilots? Do you find that they are in general open to pilots and they are sort of long term in their thinking? What would your ask be of them or recommendation be of them?
Yeah, I think ultimately healthcare organizations, they need to be open to pilots to, to get started and really test it out. But I think a lot of healthcare organizations kind of fall into two camps. There are those who really want to partner early, try things out, and really influence the direction of where it's going to go to meet their needs. And then there are healthcare organizations who, only want to buy it after,
Mm-hmm.
10 other hospitals have all given it a thumbs up. And so I think it's really finding which organizations are really laser focused on how can we, uh, innovate with you over time. And I think one of the great things about certain healthcare organizations, when you look at what makes a great pilot partner, is they're able to look at, where's a use case I can get started with.
Mm-hmm.
Because, like you said, like, well, maybe we have questions about quality and we're not certain about that. Well, let's find a use case where, we can actually benchmark the quality and get really comfortable with it.
Yeah.
Or it's like, well, let's find a use case where, if it screws up, that's not a big deal, but we can see if there's a real benefit there. And I think that willingness to be able to say, let's find the test use case that's relevant to our organization and grow with that and expand with that over time. And that's what I think what we've seen with a number of our pilot customers now is that they've looked at these translation use cases where they're actually having a human in the loop for this. Like, we're generating the translation and they have a human who's like looking at it and then signing off on it. But because what they would have taken for previously, that might have been 2 hours of work for someone to generate that translation. We get it down to like 10 minutes. And that's transformative for them and giving them time back to do their regular interpretation work. But that gives them the ability to say, okay, well, actually, we become very comfortable with the translation quality. And then we can also capture edits that they make in the translation side, get some things out for third-party review as well. But, similarly, like on the interpretation side, just really getting it out and to say, like, well, let's find those use cases, whether it's administrative, check-in, front desk, or they're quick touch points.
Yeah.
And I think part of it is like just training them, saying it's like, well, these are the use cases where AI is appropriate now. If you find yourself drifting into a conversation that doesn't feel like it, you have these other resources that you can pull in just knowing how to do that.
Yeah. I mean, to me, it feels like you sort of have a binary question up front as a healthcare provider. Are you a healthcare provider, the health system, large MSO, whatever the organization is that has a large portion of patients that are in this criteria of not being fluent in English.
Mm-hmm.
If you are, it sounds like the advice, which makes a lot of sense, is go out of your way to find a way to use this technology, because this is the pathway of your future. It's almost like the evolution of a child becoming an adult. And at this point, this technology is maybe more in the early childhood stages, where it needs a lot of patience, a lot of flexibility, a lot of support, a lot of nurturing in order to get to adulthood. But the benefits of getting to adulthood are broad and important. If you're a hospital that doesn't have a lot of these patients, I could see not choosing to allocate the time and resources to this. But if you are, it sounds like it's pretty close to a must, and from many perspectives.
Yeah, and I think an additional factor in that is when you think about there's a lot of concern about, like, well, what if the AI makes a mistake? And that's a very valid concern. However, humans also make mistakes.
Yeah.
And I think, and that's a very real situation. But I feel like there's also a little bit, in the industry being very gun shy about, even like when you look at the harm that happens by not having communication, balance that against the potential for a mistake, there are really good reasons why you should say, okay, well, here are a whole bunch of places where we're not doing any communication at all. These are low risk. Let's start doing that communication there.
Well, this is
But I think you often have sometimes you have a knee jerk reaction. It's like, well, if there's any potential for mistake, we're not going to do anything.
This was the point that the head of data strategy for a large health system in New York was making to me the other week. The imperfections in the system today are there and real. And so sometimes the technology can actually improve upon that, but still not be perfect, but it's still an improvement on status quo. But that's just so counter to the culture of a lot of healthcare organizations. And that's their job, to be skeptical. I mean, they are in life-saving situations, and they're taking care of people. So it's a delicate balance.
Yeah. And actually that kind of ties into, I don't know how visible it was on the demo, but because one of the things that one of our goals here is really to be a tool in the arsenal right now. And so when you look at that, you can see the transcription of what you're saying, you see the translation, and it speaks the translation, but we also generate a back translation, which basically says, okay, well, let's translate back what you said in Spanish back in English.
Mm-hmm.
So that gives you the ability to double check the translation and the round trip to give you a little bit more confidence. And if you find yourself saying, we're having a miscommunication here, that's when you can say, okay, well, let me use some of the other tools in my arsenal, because this might not be the best use in this.
Yeah. And I think, experimentation in something like this is probably good, subject to a few criteria. One is cost, one is burden to roll out, and one is quality control and sort of the controls, the safeguards in place. So you just mentioned a safeguard, but can you talk a little bit about cost and burden to implement for these pilots?
Yeah. I mean, overall, the cost is, we're able to provide this at much lower cost than is done by human. There's really not a lot of burden in terms of deployment. You think about it, like, we don't require any EHR integration. We could do that for healthcare organizations that want, but like, this works completely independent of the EHR, particularly because there's so many interactions that you're going to have that are outside the context of an EHR. We didn't want to, force people down that road. So, that doesn't have to be done. But it's really, in terms of, a deployment, it's like, okay, well, let's, determine which users get access to it, and make sure that you can access the site that this runs on, and then decide, what your delivery mechanism is. Is it desktop? Is it, iPad? Yeah. So there's the cost of deployment is quite low.
If you had to project how far away we are from that point of inflection that you referenced earlier, where the AI in this function is more competitive than the human solution holistically, are we a year away from that? Are we 5 years away from that? It's hard to say.
I think I'm going to be provocative and say I think we're about a year out for Spanish. Okay. And I think for other languages, they'll follow closely after that. Like, I'll give you an interesting example. There was a study that Boston Children's Hospital did, or they published on last year, where they were looking at, they were comparing Google Translate, ChatGPT, and human translators. And they were looking at discharge summaries. One of the things that they were, so they would generate those, they would translate them using those different tools, and then they would have people evaluate which ones do you like better. In the findings of that study was, for Spanish, there was actually a preference for the AI generated ones.
Mhm.
over the human generated translations. Portuguese, and I think when you looked at like the scores across like adequacy, fluency, meaning and severity, Spanish was consistent or above human. Of Brazilian Portuguese, they were kind of on par. The translation quality was considered good, and like I think it was like roughly 50%, 50-50, which was better, AI or human generated. But then like Haitian Creole, it was very clear that human translations were preferred in that scenario. And so, and I mentioned this because this was a study that was published last year. This was done on the year prior. Actually, the work was done a year prior. That data is based on what the state of the art it was in AI in 2023, and it's only continued to advance. So I think we're going to get to a place where Spanish, it may already be there, or it's about to be there. I think Brazilian Portuguese, Haitian Creole, those are going to follow, but they're going to be further out. And I think we may be able to accelerate them by very targeted improvements. But I think 1 year for Spanish, 2, 3, 4.
And when you say we're going to be there in a year for Spanish, is that just for emergency room type use cases, or it's just as relevant a year from now in emergency rooms as it is in a gastroenterology practice or a urology practice?
Yeah, I think a year from now, it'll probably be just as good in either of those. I think, the reality is a year from now, the technology will be ready, but
Yep.
the organizations might not be ready.
Understood.
And roll out the customization to them might be longer than that. But I do think that a year from now, based on all the improvements that are happening, you probably feel comfortable using it in many scenarios.
The last question I have, before I asked about what you would ask of a CEO, what would you ask, if anything, of the U.S. government, the U.S. healthcare market holistically, to allow for faster, safer, better adoption of technology? Is the way that we're structured today adequate? Or would there be some type of national data repository or change in regulation about flow of data? Anything from a policy perspective that you would ask for that would allow us to get to faster, better outcomes in technology adoption in healthcare?
Yeah, I think probably the biggest ask would be to have a better framework around when is it acceptable to have language services provided not by a human but by AI.
Mm-hmm.
Like most of the current legislation really says for critical operations, you must have this reviewed or performed by a human. And it leaves open to interpretation what are all the other interactions that you might want to have there. And so that allows organizations to try and pilot now, but having more clarity around how you get there. Because I think one of the challenges is like there's no real good way. There's no national test or standard that we could apply to say, if you're able to, if your translation engine, scores 95% on this test, it's as good as a human. There's not a good evaluation metric. And that would be something that I think would be really helpful, of being able to say, well, how do we actually validate that this meets a standard that people are, that the industry is comfortable with?
So limitations on where, when, and how technology can be used in patient interactions, it sounds like. So let's say a year from now, the technology is there, and are there going to be, but the regulations are still ambiguous. And so you still have adopters that are confused about how they can use this technology. Do you envision a lot of stakeholders that are going to, raise their hands and sort of push back on the adoption of this technology? Who do you think will be the supporters of this? Who do you think will be the people that will be opposed to this technology that might make some of those regulatory changes more challenging to push through?
Yeah. I mean, I think the people who are going to support this are going to be both the providers and the patients, because, it is, improving both of their experiences to have this by having, faster, cheaper, more accurate interactions over time. And I think that was what we're going to see. Because, I mean, if we're being honest, I know so many clinicians who use Google Translate in their practice because they don't want to use, because either they don't want to, they don't want to pay for it, they can't access the human based services.
Mm.
They're not supposed to use Google Translate, but people do.
Right.
And so there's this huge desire, need for, a product that is HIPAA compliant, that's healthcare focused, and will grow. So I think, as people begin to see, wow, this actually really works here, you're going to see a lot of push to actually make sure that not only the users are comfortable, but like the administrators are comfortable in using that. I think on the flip side, I think a lot of the opposition to this probably will come from organizations that want to provide just humans for this. And I think there's still going to be, I don't think those organizations are going away. I think there's still lots of opportunity for human interpretation, but I think it does mean that it's going to be sort of boom times for highly qualified, highly skilled interpreters. But for people who really don't have a lot of that domain knowledge, it'll be a lot more challenging.
Does this type of technology go through FDA or other type of regulatory approval?
It does not, no.
Joe, I want to thank you, and firstly, congratulations on what you've built so far, and just in general the mission that you're looking to solve for and the progress you've made to date. And I wish you lots of luck on the continued journey for Jaide Health. But thank you so much for spending the time with us.
Thank you so much.